Set, Pier.
In disaster management, the roles of nurses consist of a cycle. This cycle illustrates the ongoing process by which governments, businesses, healthcare professionals, and other civil society plan for and reduce the impact of disasters, react during and immediately following a disaster, and take steps to recover after a disaster has occurred. Appropriate actions at all points in the cycle lead to greater preparedness, better warnings, reduced vulnerability, or the prevention of disasters during the next iteration of the cycle. The four disaster management phases include mitigation, preparedness, response, and recovery.
Mitigation activities eliminate or reduce the probability of disaster occurrence or reduce the effects of unavoidable disasters. Mitigation measures include building codes, vulnerability analysis updates, zoning and land use management, building use regulations and safety codes, preventive healthcare, and public education. The roles of nurses in mitigation include risk assessment and analysis, assessment of the local coping strategies, current community disaster plan, availability of health personnel and facilities, and readiness of local agencies and organizations. Nurses determine actual and potential disaster threats.
The goal of emergency preparedness programs is to achieve a satisfactory level of readiness to respond to any emergency situation through programs that strengthen the technical and managerial capacity of governments, organizations, and communities. During the preparedness phase, governments, organizations, and individuals develop plans to save lives, minimize disaster damage, and enhance disaster response operations. The role of nurses in disaster preparedness include knowledge about community, ability to perform first aid and CPR, communication skills, ability to be part of the rapid response team, and adequate knowledge to perform emergency response skills.
The aim of emergency response is to provide immediate assistance to maintain life, improve health, and support the morale of the affected population. Such assistance may range from providing specific but limited aid, such as assisting refugees with transport, temporary shelter and food, to establishing semi-permanent settlement in camps and other locations. It also may involve initial repairs to damaged infrastructure. The focus in the response phase is on meeting the basic needs of the people until more permanent and sustainable solutions can be found.
As the emergency is brought under control, the affected population is capable of undertaking a growing number of activities aimed at restoring their lives and the infrastructure that supports them. Recovery measures, both short and long term, include returning vital support system to minimum operating standards, temporary housing, public information, health and safety education, reconstruction, counseling program, and economic impact studies. Recovery activities continue until all systems return to normal or better.
Nurses are important in reducing the effect of disaster in the emergencies, the community, family, and the individual. Knowing how drastic emergencies and disaster situations can affect both physical and mental health of individual. Nurses assure that they are managed based on their needs. Disaster and emergencies are global phenomenon. It can occur anywhere and anytime. With the active participations from our medical frontliners, we will be able to conquer this disaster and limit its tragic effects.